Hi,
Hi,
everyone.
everyone.
Welcome back to another episode of Can We Discuss with Yara and Petra.
Today's episode is a bit different than what you've been used to so far.
Yeah.
And we have our very first, very special, very good close friend and Dr. Samar Khalil.
Yay, I'm so
Thank you so
excited.
much for having me, Yara and Petra. So I'm a dermatologist. I practice here in Dubai and also in Lebanon, and I'm Yara's doctor.
And Petra's when she's in Lebanon. But
Samar is
we're so excited to have you today, Samar. So, for today's topic, what we really want to be talking about, given the type of doctor that you are, is cosmetic dermatology and some of the trends that we've been seeing. And then also, of course, we're going to do a little comparison with the US trends and trends happening in the Middle East. So, Samar, kick us off. Tell me, what are some of the major trends that you've been seeing right now in the cosmetic dermatology world, and some differences that you've noticed between the trends here in the US and in Dubai?
All right. So, of course, two of the most commonly performed procedures are Botox and fillers. First, I think it's very important to clarify the difference because some patients don't even know the difference between both. So,
okay.
Botox is actually a brand of botulinum toxin, which is the treatment. What botulinum toxin does, it weakens your muscle. So, all of us, when we move, our facial muscles, when we express emotion, we see these dynamic lines, which are the lines that appear when we move our muscles. So Botox or botulinum toxin targets that. Why do we want to target that? Because with time, these lines are going to become static, meaning permanent. And this will make us look a bit more tired, a bit older. So I don't think anyone would want that. So that's
No,
why we
no.
recommend injecting botulinum toxin when you start to see those lines.
Okay.
Fillers, on the other hand, are substances that you inject to fill. For example, if someone lost a lot of weight, a lot of volume in the face, or if someone is getting older, we tend to lose volume in the face. So we would want to fill the areas that have become volume deficient. And there are different types of fillers. The most commonly used are the hyaluronic acid fillers.
Okay.
For example, you would inject fillers in the cheeks, in the lips, in the chin, the jawline, etc.
Yeah, first of all, I'm due. Second of all, I only learned that Botox, maybe this is silly of me, but that Botox was a brand versus what it was actually doing when I moved to the US. Whenever I come to your clinic, you'll explain to me what it is. You also gave me the option between two
Yes,
different
so I actually
brands.
offer two brands of botulinum toxin,
Yeah.
and I always tell my patients it's very important to know which brand you're using. Sometimes you may like a brand more than the other, sometimes the brand may last more, and sometimes you may go to a clinic, usually not a very respectful clinic, where they might choose brands that aren't really approved or very good brands. So it's very important to know which brand you're using.
Yeah, see, when I came to you and you asked me that, I'm pretty sure, I don't know if you remember, but I was like, I have no idea. Um,
طلعت
but
فيها هيك قلتي لها دكتور ما بعرف يعني انت اللي بتحسي اضبط شيء لإلي.
yeah, and then that's why now I just made a decision that I'm just not gonna do anything anymore here stateside. I'm just gonna wait until I'm back in Lebanon and do it all with you. I think that's just the better approach here. Um, but yeah, so what are some of the trends? I mean, obviously, like with Botox and filler, something I've noticed at least, and something actually some of my friends from Turkey were talking about this weekend when they heard that you were going to be on the podcast, was in Turkey, which I think in the Middle East it's similar, but I don't know how true that is. They tend to, they're a little bit, they're very generous, is how they put it, with how much Botox they'll put, etc. But for me here in the US, it's quite the opposite. Like they'll go for the bare minimum at first. And then if you want, because obviously here, the pricing is also different. So they price per unit here. So you kind of like have to go in knowing exactly what you're asking for versus over there, you feel like it's more of like what you need, you know?
Yeah. So as you said, Petra, of course, there are cultural differences. Working here in Dubai, I think, allows you to see a lot of the cultural differences because we do get patients from different parts of the world. I don't like to generalize, but I will tell you the general trend that I'm seeing.
Yeah.
So with Europeans, with Americans, it's kind of similar. Patients like it to be very natural. They come, they're often very scared, worried. Please, doctor, I don't want to look. I just want to look like myself. I don't want to look like another person. And because really the culture there is not about exaggeration. The
Yeah.
Arab world, and keep in mind I'm an Arab woman, I feel honestly there are two different types of people. You have the people like me and like you guys who are very natural, like it to be very subtle, but you also have the other type who want their filler, want their Botox to show. Some patients are actually disappointed, and I'm disappointed when they tell me this. They want it to show. They want people to notice that they've done something, which personally is not my style. So usually those types of patients, because they see my social media, they see the results, I don't get a lot of these patients because they
Makes
know
sense.
it's not my style. So yeah, so here in the Arab world, for example, you have patients who like the Russian lips, which are these huge lips that we see on social media. You have patients who like the frozen look with Botox with really no emotions. And you have, on the other hand, those who like it to be supernatural. So yeah, I do see both.
And
Yeah.
then, I mean, هلا, because we're talking about Arabs in general, but I feel like, and this is just me purely off of social media, obviously, but I feel like a lot of people have started wanting the مثل كيف في the no makeup look, the no Botox, no filler look. And I feel like the younger patients, or that's the trend that I'm seeing, are kind of going for that. يعني انه ما رح يبين انه حاطين، بس هن عن جد حاطين بس كرمال to either preserve what they currently have, or to make sure they just don't lose it in the future, or because they want the look but not fully. Is that something that's kind of very common هلا?
100%. So I think also around the world, the trend has changed. So before, these procedures were done to drastically change a feature. Nowadays, a lot of people are going for subtle enhancement of their features. So they, as you said, they want to look good without having to, wear a lot of makeup. And I think this is very important. We call it, patients in Lebanon love this term, tertib, especially older ladies. They come,
صح
they're worried, they're
بنرتب.
scared. I tell them, don't worry, نحن بس رح نرتب ما رح نغير. And they love it. It works. So yeah, and one thing that's very important is also individualized treatment or personalized treatment. So before we used to do everything the same for everyone. Now we know that what may look good on you might not look good on Petra. So it's very important to see what suits each person. I'll give you an example. A lot of patients come for gummy smile treatment. And when we do the treatment, they love it. Personally, I've tried it a few times, and every time I do it, I, I just don't feel like myself. So now I do realize I have a gummy smile. And some of my patients tell me, Doctor, why don't you treat your gummy smile? I don't.
Part of who you are.
Exactly, and I don't mind it. So you decide what you like, and it's okay to have some imperfections. You don't have to change everything that doesn't fit the norm or the norm of what is considered the most beautiful or the most aesthetically pleasing. Yeah.
Okay. I think, okay, Petra, so I think this is so interesting, right? I think هلا Samar mentioned it وأنا وياك دايما بنحكي فيها إنه what works for me does not necessarily work for you. And then we need to understand what is going into your face and what are some features that you'd like to kind of enhance just a bit. What are some things that you want to change? مثل كيف أنا before my wedding, obviously Botox is a thing I've been doing for, I want to say 4 years now. The first time I did Botox, obviously Samar as well. And I was one of the people that was like, so, doctor, please, let's make sure and it's not too much, blah, blah, blah. And then obviously became addicted to Botox.
Now she comes and she's like, do whatever you need to do.
Just make sure my crow's
Just fix
feet don't
it.
show anymore. And then I did Profilo, obviously, right before my wedding, and something that I always just keep recommending to everyone, right? And I think now, like, I'm not scared to test out these procedures in tiny doses. But then the difference, of course, is Petra, انت شوي بتعتري هم انه كيف بدك تقعدي تعملي اشياء شوي شوي، عرفتي؟
Yeah.
ما هيك؟
For me, I've always this is gonna sound so fucking cocky, but, for me, I've always like, I've always had this like sense of pride in the sense
Yeah,
of like,
I don't do
oh, I've never
anything.
had to like get my nose done. I've never had to like get my lips done, you know? I'm sure there's a lot that can be fixed and that can be done. And there's people that don't prefer how I look now, could see it being enhanced, whatever.
But
But
it's
for me,
about تكون مقتنعة أنت ب how you
صح.
look كمان.
صح. But for me, I was just maybe a little bit too مقتنعة, you know, until until our weddings, and that's when I first started doing Botox. And even with that, like I was definitely like freaking out. I tested it first here, and Yara was like, "You have to test it before. Like you can't do it right before your wedding. ما بتعرفي like how your face is gonna react to it." I'm sure she got that from
Common
you.
advice.
Yeah. So I was like, okay, بس أنا بأمريكا شو بعرفني هون شو بيعملوا بوجهي. Like I was freaking out إنه ما بعرف حدا هون, you know, like,
Yeah.
and obviously like Jason's cousin here used to work at a clinic that used to do that, but I didn't go there because that was too expensive. But I went to someone that I didn't really know but had good reviews. So for me, my first experience was definitely panic. يعني على الآخر. But then now I love it. And now I'm like obsessed with it. And it's amazing because it's really true that you don't need to change how your face looks like at all. It's literally مثل ما عم تقولي just enhancing like your natural features. And for me, the biggest thing is prevention, because I've seen how our skin reacts. We've seen you know, like my mom, my grandma, my aunts, like all of them, bless their souls, they're all beautiful. But no, wrinkles definitely stick in our family. So like I wanted to make sure that we were preventing that.
Petra, I have a question for you because you said you used to be proud of the fact that you haven't done anything.
Yeah.
Now, do you feel ashamed telling people that you've done procedures?
No, that's the funny part about it, is that now I don't feel like Botox changed anything. For me, obviously you know this, but like I just do my forehead because I'm a very expressive human. But I don't feel غلط. And like مثلا one thing that's always been not an insecurity of mine, but like my lips are something that I've always wanted to not put in fillers or anything, but just do like the coloring عليهم, you know, like that tattoo or whatever that they do. Um, but now I feel like it's every single human that I know has done something, and I'm now like مقتنعة إنه منه شي غلط. Like it's not something that's like off, it's not something that's weird, it's kind of the norm now, you know. And بالعكس, if it's something that is going to make you feel better about yourself, I'm all for that, you know.
I like proudly say like Botox خلاص I swear by it. أنا ما بعتقد Botox is the one thing ما بعتقد بوقفها بحياتي.
Yeah, yeah,
Like
yeah.
but
Me too,
I
I'm the
started.
same now.
Yeah. No, I mean at this point إنه ما فيها شيء غلط. ما فهمت إنه الشخص ما عم
No, yeah.
بيغير منظره.
True.
ما
صح.
حدا عم بيقول لك إنه روحي غيري your jaw غيري خدود غيري كل وجهك. You're
That's
still you.
you know why sometimes like I'm on social media and I see comments like, oh, she's so pretty but she's full of fillers and she does a lot of Botox, a lot of plastic surgery. I think it's also how people comment on certain beautiful women. They
100%.
sometimes it's true that they've done procedure and there's nothing wrong with that, but sometimes they haven't done anything and they just want to. I think of course it stems from jealousy, from different factors.
Mindsets as well.
True.
Insecurities too, don't forget. Like that
Insecurities,
plays a big
exactly.
one. Yeah.
But I think it also just touching on the social aspect of it, right? I think from on the social aspect of it, in our in our family or in our dynamics, the way that we are, the way that it's been. Anna, I started Botox and I didn't obviously ask permission because to me this is not this is very personal.
From your husband, you're talking.
Yeah, so from my
Or
husband and just
parents.
like in general, like telling my parents, telling whatever, I just told them, I informed them, guys, I'm going to start doing Botox, right? It wasn't something that, it was none of anyone's business. And my husband never minded, right? Because to him, it's like, إنه اعملي اللي بدك إياه, إنه your face, your body, your whatever, your decisions. ما عندها مشكلة. اللي أنت بتحسيه أحسن لإلك واللي أنت مقتنعة فيه اعملي. عرفتي؟ Petra, on the other hand, and then I'll give the mic to someone to comment on this.
For me, my husband is, I think, صار عنده ردة فعل because of how many girls that he's seen go through so many procedures, like where they started and where they ended. He's seen the difference, قديش انه it becomes drastic. And mind you, some people, they want it to show انه انا دفعت مصاري بدي بين انه انا عامله شيء مش انه كانه ماني عامله شيء, you know. So Jace is, when I told him that I want to do Botox, obviously he also is like, whatever you want to do it. But he's not like encouraging me to go do it. You know what I mean? Like when لما طلعت, he was with me, وهيدي يمكن غلط, بس لما طلعت أول مرة عملتها كان هو معي. وطلعت and there was bumps naturally, right, on my forehead, and he freaked out. You know, he was just like, what did you do to yourself? Like, what did you do? Why did you have to
See,
do
I
that?
told you.
You know?
Yeah.
So yeah, but obviously again, like it's just because he's always like, you're so pretty, you and your sister don't need to do anything. And I think like when Yara put in her lips, yeah. But yeah, when Yara did her lips, and it was like barely like for the wedding or something. هلا you don't anymore, بس انه he was like انه زعل من يارا عشوائي, عرفتي انه انه she's so beautiful, like why does she need to do that, like every other girl has a huge lips, but you guys are so beautiful naturally, that's what's missing in the world, you know what I mean?
Yeah. When it comes to significant others, there are two types as well. So some are very supportive. Some are, actually, there are three types. There are those who want their wives to do and their wives don't want to do anything, or the opposite, wife or husband. There are some who are like neutral about it. You do whatever you want to do. And there are some who are completely against it. And sometimes it puts the doctor in an awkward situation, especially when you know both people, you know. I think it's very important to communicate. I personally don't like it when couples hide what they're doing, because sometimes it shows and sometimes it actually creates problems in the couple, between the couples. A lot of women especially wait for their husbands to travel before doing certain procedures. I see this a lot in Dubai, especially for procedures that have a downtime. So if, for example, with lip fillers, you might get bruising, you might get swelling. So they wait for their husband to travel and then they do it. But yeah, I don't really like it. My husband, fortunately, is completely with, he's a plastic surgeon. He does my Botox, he does my fillers. So obviously has no problem with it. And yeah, I think communication is everything. And I think it's also important to remind, especially men, that the people you see who look fake are the people you really focus on in society. But there are the others who have done something, but you don't know that they've done something because it looks natural. So just, it's important to show them that it can look natural. And I try when the husband comes during consultation to show them before and after pictures, and sometimes it works. Sometimes they tell me, oh, I didn't know it could look like this. If it's gonna be like this, I'm fine with it. So it's, yeah, sometimes it's good to explain to them and include them in the decision making process, but of course it's the person's decision, not anyone else. If the person is an adult.
I have a friend that she just mentioned that her husband was completely against her getting Botox. So she went ahead and did it anyway, without telling him that I'm going to go have Botox, get Botox or whatever. And then after a while, when she came back home, and after a while when the Botox set in, she looked at him, قالت له حسيت انه في شيء تغير، في فرق انه بوجهي. قال لا شو صار بوجهك انه بك شيء اوكي. She's like, yeah, see, I got Botox, you didn't even notice.
Yeah.
That's a very common scenario, honestly.
But for me, مثلا, إنه Botox is one thing. لأنه Botox, I feel, like I said, like, I don't know. I mean, you know better, Samar, how much of a difference it can make. But the way that I do Botox, it won't make a difference. But مثلا, fillers is something that I feel like, how can you hide lip fillers from your husband? Like outside of the fact that you're going to have completely new set of lips, you know, that are going to show. إنه ما بيحس فيهم, like when he's kissing you he's not gonna notice the difference. Like it's very weird. Like how can you hide that?
So it depends where fillers were done. So for example, when you do
Okay.
cheek fillers, some patients
Okay.
really have a lot of volume loss, and when you inject fillers, it just makes them look a bit healthier. So comments they often
Okay.
get is not "oh you've changed," but "oh you look healthier." وجهك مرتاح. Exactly.
Huh.
When it comes to the lips, when you first do them, you can feel the filler a bit, and of course there might be bruising, there might be swelling, so it will show. But after that, it actually becomes soft, and you can't feel it even when you're kissing your significant other. So a lot of my patients hide the fact that they've done lip fillers, and their husbands never notice. Exactly.
That's
So it
That's
depends on the area. It depends how it has been done and how much has been injected.
yeah, أكيد. But so شو بيكونوا إنه قايلين لهم that their husbands or they used to do it before they were married or engaged or whatever, and then they just kept doing it. Because I feel like my husband would definitely notice إذا شفايفي all of a sudden are double in size.
No, but when it comes to lip fillers, again, you can do it in a way to volumize, or you can do it in a way to just give it a very subtle plump, just to hide it. For
Okay.
example, I've done my lips twice so far,
Yeah.
and it no one noticed because I barely put anything first, and two, it was mostly to hydrate because I have these fine lines. So it depends what's your goal and if you really want to add volume or not.
Okay. Okay.
And I
I
think
think
it
that
depends on كمان like I don't know بس إنه how often the person goes and they do them قد إيه
True.
بيكبروا كيف if this is like very medical I think بس إنه if they dissolve before they put them again إنه بيفرق كتير على الشخص no.
This is actually very important because when it comes to fillers, especially, you have to control yourself. A lot of patients start wanting for it to be very natural, and then with time, because they get used to the new look, they start to want more, and then they really forget what they looked like before. So this is actually very important. You have to the patient has to control themselves, and even the doctor has to be ethical and say no when the procedure should not be done.
Yeah, I think that's that's a whole other story. That's a whole other
A
story.
whole other topic.
But I
yeah,
think
no.
كمان بكره بعدين بس يخلفوا هول العالم ببينوا بالاولاد الفرق تبعهم.
You know about this guy who divorced his wife because when they had children, they looked very different. I know kids are never ugly, but they looked very different from their mother.
Damn, did he not like he just يعني he divorced her because he found out that she was plastic, or did he possibly think that there was a third person who came into
I
the
don't know. I don't
mix?
know about that.
بركة طلعوا بيشبهوا البي وما طلعوا بيشبهوا الام ابدا وهو كان
Um,
مفكر انه حيطلعوا حلوين مثل امه.
مثلا. Yeah, no, I think it's crazy because if we go back to like the US versus the Middle East kind of culture difference when it comes to these things, بضلني أنا here now there's a lot more. I'm seeing it. It feels almost as if the US is starting to catch up. I don't know. يمكن لأنه I'm a bit behind, but it feels like the US is starting to catch up in terms of what you can do with fillers, in terms of like your jawline, your cheekbones, whatever people do, like your chin, like your nose now. People do
And I
like,
think social media plays a big role in that as
yeah,
well.
100%. But I think like you're laughing at my 100%. But I think, but I think now I'm starting to see it a lot more trending هون versus it's been trending for a while since we were before college. I remember بلبنان, like this was always like Lebanon was at the forefront of if people wanted to go plastic surgery or, like cosmetology, it was always like at the forefront بلبنان.
It's at the forefront بلبنان لأنه people I think people talk about this a bit more and people have بيهتموا بحالهم the way that they look a bit more too. I think it's just in our culture تنهتم
Yeah.
بهول الأشياء. And
Rem-
it's not about the procedures, and then I think it's also about, I mean, ever since we've been 12 years old, mom's always like, guys, moisturizer, moisturizer, moisturizer. هيدا
صح.
أهم شيء لرقبتكم ولوشكم, it's something من زمان وجاية. People in Lebanon, I think, are very used to بس يهتموا بحالهم كبشرة ما ضروري procedures or cosmetic dermatology. You know what I mean? I think even our grandma's sister, like my mom's aunt, she was I think bال 80s, and I looked at her and I'm like, واو وجهك كتير حلو. قالت لي أهم شيء تمسحي وجهك بالموارد الصبح وعشية
So
وتحطي
cute.
مويسترايزر.
Mewarid is a very important ingredient that plays a
For
really
us,
big role.
right? This is like a
Yeah,
very cultural thing as well. But
especially
what
in
do you
our
think? Is
family
it
coming in.
really, especially in our family, Anjad, it's a big one. But what do you think? Is it like also a cultural thing that you see?
I definitely think it's a cultural thing, but I don't agree that everyone in Lebanon is so open about it. A lot of patients are still, I still think it's taboo. They do these procedures and they don't really want to talk about it. And I think with time, this is really changing. And I love this. Like, if you compare the older generation to now, if you compare my mom to me, for example, my mom was completely against. And then after I forced her to do it, now she asks for it. I always tell this to patients, you fear what you don't know. I mean, yes, some people might think, oh, they're so silly. These are elective procedures. But really, the way you look can really affect the way you feel and your mood. For me, it's very important to feel good about the way you look. So that's why, to me, it's so important. And we should be discussing these topics and not being ashamed of wanting to improve our looks, you know?
Yeah.
Because it's also part of the well-being, right? Overall well-being. And كيف نعم we exercise, كيف نهتم بحالنا, we sit in the sun to just get our vitamin D and whatnot. It's part of our well-being. to كيف منظرنا, it affects us.
Don't sit in the sun.
Sunblock.
Yeah,
And
it
by the
is.
way, this is a myth. You take tablets for vitamin D, you don't tan.
Oh, there we go. That's a myth buster.
Mythbuster. That's a mythbuster. That's going on one of the reels.
Yeah, for sure. But I think I 100% hear you when you say it's such a taboo topic that now is becoming a little bit more accepting. What I'm interested in is because you have clinics both in Lebanon and in Dubai. So let's dive deeper into like the Middle East itself. Outside, let's leave the Westerners on their own. And what are some of the differences that you've noticed within the specific topic when it comes to the culture in the UAE versus in Lebanon? I know there's a lot of overlap between Lebanese people in the UAE, but more like Emirati women or, you know, Khaliji women in general versus Lebanese Arabs.
I mean, again, it really varies depending on the person. And the problem, it's not a problem. I'm lucky, but most of the patients who come to me are the same style. They want it to be natural. But we do see on social media patients with these Texas jawline, which are these huge jawline. To me, that's not really nice in women because it can make you look more masculine. Exactly. We do see these women with, again, the Russian lips. And by the way, the Russian lips, some of them, because some patients tell me, but they look nice. Some of them might look nice on social media, but see them live, you see this mustache of fillers above the lip. It's really not natural. It's really not what lips are supposed to look like. So I don't like it. And sometimes you see these huge cheeks. I mean, there are certain things that are really unnatural that we're seeing. But in general, again, I don't like to generalize. Some Emirati women like it to be supernatural, others like it to be a bit more exaggerated. The same goes for Lebanese women. Some
Yeah.
like it to be
So,
supernatural, and others, I mean, go to the mall in Lebanon. You see,
all
sometimes you see
kinds.
beautiful women, very natural, but sometimes you see duck lips everywhere. It's crazy.
Samar, as a doctor, right? Do you notice if you're just talking to a person, can you notice all the
Yeah.
procedures? Yeah.
That's one thing as cosmetic doctors or aesthetic doctors that we don't like. When I'm talking to someone, I'm just thinking, oh, she needs this, she needs that, or she's done this, she's done that. But no, I'm just kidding. It's not that bad. But yeah, we do notice when someone has
Of
done something.
course.
If it's of course done super naturally. Sometimes it's hard to say to tell, but in most cases we do know.
Yeah.
I've always wanted to know, right? Like وقت يكونوا عم يطلعوا فيك doctors in general, خصوصي إنه
What are they
cosmetic
thinking?
dermatologists or plastic what do they
Yeah.
see, you know? Do
Yeah.
they
Yeah.
see the same things I see?
100%. I don't know if you know Dr. Nasif, Paul Nasif. He has the show Botched here. He's a Lebanese doctor. So some weird connection. We were like at dinner with him at one of Jason's cousins' houses, and I just sat there and I was like, tell me what I need to do, like what would you do if I was your patient? And he just laughed because he was like, that's what everyone kind of like asks him when they see him. And I'm sure it's the same with you, right? Because it's like,
Yeah.
oh my God, and your husband come in, Ayan, even more so maybe, where he's like, what should I, shub jawbik, because I can tell you a million and one things.
That's actually important, Petra, because when it comes to patients, some of them like for you to tell them everything, and
Yeah,
some are actually upset if you tell them you need this, and some they exactly know they know exactly what they
what they
want.
want.
I don't like it when patients tell me, "Oh no, you decide," because you have to see what you like as well,
Yeah,
and I don't like it when patients know you have to do this. I think it has to be like a
Somewhere in
give and
between.
take.
exactly somewhere in between, something that the patient will like, but also the doctor thinks is suitable for that patient.
Yeah.
Yeah. Yeah, I think that's very important for sure. What's your one piece of advice that you would give someone who wants to start the journey of Botox or filler or just like, cosmetic dermatology in general?
Okay, so this is very, very, very important, whether it's in Lebanon or in the UAE. Go to a professional. Don't don't go cheap on your face. You can buy fake bags, fake clothes, whatever, but when it comes to your face, don't inject something that you don't know what it is. Don't go to someone, like some patients tell me, I went to this person, I'm not sure they're even a doctor. Are you serious? How would you inject something when you're not sure the person doing it is specialized and is qualified to do this procedure? So please go to a professional, ask about the product that's being used, write it, have a notebook if you plan to do these procedures regularly, write the date, put the sticker of the filler of the Botox for the doctor to know which brand has been used, and keep it natural and stay true to who you are. Basically, this sounded
Yeah.
very cliche, but keep it
But
very
it's true.
natural.
I mean, it's true. Like, just stay true to who you are in terms of obviously everything, but then what makes the most sense for you and how you want to look. And
Yeah,
it's so important. A doctor plays a huge role in that. And I
for
mean, that's
sure.
why we
I
stick to
think
Dr. Samad, but I mean,
Yeah, I think especially for someone like me who kind of is living in between like two different, I'm living in the US, but like I go back and forth between Lebanon and here. I think that's would have been very helpful if I heard that from you in terms of like at least keeping a notes on my note app, whatever it is, where I'm just like keeping track of what I'm doing, how many units, all of these things, because the clinic does, but I don't. And then also the other thing is making sure that they're actual doctors here. um it's only nurses. Like nurses are what I've had my experience with. You are the first doctor that I go to for something like that,
Yeah,
and
so this
the
is
last.
another cultural difference. In the States, there are nurse practitioners who are licensed to perform
Okay.
such procedures. In Lebanon and Dubai, only doctors and only certain specialties. Unfortunately, we're seeing
Oh,
doctors who are, for example, OB-GYN or endocrinologists who are performing these procedures. In Dubai, certain specialties of dentistry are allowed to perform such procedures. In
oh,
Lebanon, they're not allowed. So, Kamena, you have to research which special. I mean, I would personally go to or a plastic surgeon or ENT.
that is a big difference here. And I think like obviously I know that all of the nurse practitioners here that do it are licensed to do it, but that's definitely an interesting observation to know that, like, in the region, it's more so specific specialties and specific doctors that are allowed to get that license. So that's very cool for sure. But yeah, Yara, do you want to add anything else?
no, I want someone to tell us if there is any one specific thing, additional thing that she would like everybody to know
Oh,
about
yeah.
stepping into kind of the cosmetic dermatology or just the skincare in general? It doesn't have to be like Botox and fillers specifically, but overall, is there something that you think is key for people to note?
Yeah, I always tell my patients prevention is always more important than treatment. When it comes to prevention, in terms of skincare, of course, sunscreen is the most important thing in the world. You can also use certain anti aging ingredients like retinol, like vitamin C. So these are very important to start, in my opinion, from the age of 25 and on. When it comes to procedures, as we said, with Botox or botulinum toxin, when you start to see the lines, even when you're not moving your face, this is when we recommend that you start. Of course, it's your decision, but that's the recommendation. When it comes to fillers, there's no age. It's, for me, you, if you're young, do it where you feel there that you really need to do it. Like if you have a volume deficiency, if you have really small lips that you're insecure about and you want to, or if you have dry lips, in like in my case, and you really want to give them that hydration effect, but don't overdo it. Once you're older, you're gonna need them. You're gonna lose that volume in your cheeks. You're gonna have these lines here. So you might have to, you will definitely need more procedures with time, but it's all about knowing which procedures are suitable for which age.
Yeah. I think I
Prevention, guys,
started
prevention.
prevention is key, but I think I started preventing too early. Like I think I started using that's not real. There's no such
Is
thing.
that such a thing as preventing too early?
Like my
Um,
my my creams, I feel like were anti-aging too early on. Like I think now I got my creams right, but before I think I used to use two like creams that my mom should use. You know what I mean?
We're seeing this a lot with the Sephora kids. They're buying really aggressive products that aren't really suitable for their age. I mean, I started using something similar to retinol. It's called tretinoin since I was 13, but I was using it for my acne. So if you think about it, I was preventing from a very young age, but I had a special case. And of course, the derm prescribed it to me. But with these Sephora kids, they're using really aggressive ingredients, and sometimes they're ending up with eczema, with really dry skin, with allergies. So yeah, you don't want to overdo it, and you don't want to do it when you're still too young.
Yeah. Yeah, it
I
almost
mean,
feels
I
like
think
you're skipping a few steps, like you're rushing.
one big thing I learned in terms of kind of skincare, and of course I learned it from Dr. Samar, is really understanding what products work for you. And it doesn't, more is not necessarily better.
Yeah.
Sometimes less is better depending on your face, your skin type, and what your needs are. So I think that's also very big, right? You can have all of the products that are advertised on social media. It doesn't mean that they're all really good for you as an individual.
Yeah.
And knowing that will put you on the right kind of journey for skincare, right?
Yeah.
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 Okay.
You have a good student there, right? She's
I'm
learning
a
the
good.
lesson very well.
That's something I always do with Dr.
عم
Samar.
ترجع تعدلك
Just
الدرس، عرفتي
making
انه
sure making sure انه حفظت الدرس مظبوط.
ايه عم ترجع تعدلك اياهم انه شو صح؟ Did I get it right? What's my grade?
يا الله.
10 over 10.
See,
There we
I'm
go.
telling you.
Bravo, Yaroush.
It's
Here,
really
gold
understanding
star.
what works for you. What is something, where does
Yeah.
Botox work for my face? Does it work gummy smile? Not for me. No, great. I'll stick to here and my crow's feet, for example.
صح صح صح. Yeah.
See?
Samar Hanjad, or Dr. Samar, I should say, thank you so much for joining us. I really, really appreciate your time. It was such an interesting discussion for me, at least I know, and I'm sure for Yaroush also. So thank you for being our first official guest on the
Thank
show.
you. It's a pleasure. Thank you for having me. And I want to thank you both for being so open about the procedures that you've done. So when we first started, I said I'm Yara's doctor because I know Yara is very comfortable to talk about it, but I wasn't sure about Petra. But you said it. So thank you for being open and not feeling
Oh
embarrassed
my
or
God.
ashamed.
There's absolutely nothing to be ashamed of for
Yeah.
everyone listening. I think you do whatever you need to do to make yourself feel good. You do it in a healthy way, you do it in a safe way, and that's all that matters, you know?
And everyone's beautiful in their own way. يعني مش إذا
Exactly.
عملتوا شيء
ما عدتوا
غيرتوا إنه
حلوين.
أنتوا جمالكم اللي كان خلقتوا فيه or God gave you the
راح.
beauty, you're not changing it.
مزبوط.
If you're not doing drastic procedures, you're literally preserving the beauty or enhancing
Exactly.
what you already have.
That was a lesson I
I
learned
love
as
this.
well.
So
Well,
that brings us to the end of our conversation with our favorite, Dr. Samad.
we're so excited. So, everyone, make sure that you leave any comments or questions for Dr. Samad
Yeah.
below and share with us your experiences when it comes to Botox or fillers or any of your journey when it comes to this specific topic. Is it taboo where where you live, or is this something that you're openly discussing with your friends? Let us
Yeah.
know. And as always, we'll see you right back here next week on Can We Discuss with Yara and Petra. Thanks,
Thanks
everyone.
everyone for joining us. Thank you, Dr.
Thank you.
Samad.